Hello, everyone. Welcome for joining in to this little webinar on nutritional supplements shown to slow reverse skin aging and help reduce risk of skin cancer. As I prepared to present this today, I was thinking about one of my patients from back in the day who was a wonderful guy. He was about 20 years older than me, used to take me sailing on Lake Ontario, very successful guy. And one day he noticed a lesion on his foot when he was out sailing, and it was weeping a little bit of blood. Sure enough, it was a melanoma, and he eventually took his life quite prematurely. So it's one of those very scary reminders of how your life can change in a heartbeat, and the dangers of melanoma risk. And as we live longer as a society, there's a greater risk that these things will happen. Skin cancer is the leading incident cancer. So over the years, I've taught courses on nutritional medicine to skincare professionals at a lot of conferences. Back in 2004, I wrote this book with a very cheesy title called The Wrinkle-Free Zone. It sort of had the research about nutrition and skincare up to that point, but there's so much that's happened since then. And of course, I've written the Optimal Living Program. And so now that I'm 70 years old, I'm looking at a lot of my friends and cohorts who didn't follow the advice that they would have found in this book. And a lot of them now have atrial fibrillation, congestive heart failure. They're going for hip replacement, knee replacement. They've had heart attacks. They've had angina, bypass surgery, a host of other things. And I just think, you know what, that the information in that book, honestly, had they followed it, many of those problems would not have happened. So, sometimes I look at that book and I think, why did I bother writing it? But when I see that lifestyle medicine can make such a huge difference to people, it reminds me that, for those who follow advice that you would find in a book like that, it does pay off in most cases. So let's get started. Um, there's a great book that was published by an MD. It's called The Physiology of the Skin. So a lot of the basic information around skin that you're going to see presented here would come from that textbook, The Physiology of the Skin by Peter Pugliese, phenomenal book. A publisher out of Ottawa asked me to update my book that I showed you earlier, which is coming out in September, supposedly. They called it The Natural Beauty Revolution. But really what it is it's all the scientific information related to nutritional medicine as it affects the skin. So I'll try to give you a snapshot of some of that in this hour. I think it's important, especially in the summertime, to be cognizant of this. But really, what you see is that the missing link in skincare management, and even things that affect your hair and nails as well, really is nutrition and supplementation. The premise is quite simple. The skin cells in the epidermal layers are actually every second of your life, they're extracting nutrients from the blood vessels below down in the dermis that they need for their own development, maturation, for normal appearance and function. And your nails and hair also require similar nutrients. Most of the patients that you see, actually, if they're not taking supplements, even if they're eating well, likely have some level of marginal deficiencies, an imbalance of essential fatty acids, not optimal level of certain vitamins and minerals that can be very helpful. And if they have skin conditions like eczema or psoriasis, sometimes it's making those conditions worse when you could modulate it to some degree. So adding a basic nutritional interventions can actually really pay off in a significant way to improve the skin appearance, texture, help improve some skin conditions to some degree. It's not usually the cure for most skin conditions. And also create a defense against photoaging and steps that are linked to skin cancer and skin wrinkling. So back to Nutrition 101, just to remind you that in severe vitamin deficiency states, like a vitamin B3 deficiency, people end up with pellagra. You're not going to see it in our society, but just to remind you that skin cells need these nutrients from the inside out. If I just took niacin and I put it on the skin of this person with pellagra, it's not going to change the outcome. They have to actually take supplements of niacin to reverse this condition. So here you see it at this stage, you see the scarlet red tongue. And this is after the person has been taking some niacin supplementation. The skin cells below are starting to form normally, and as you exfoliate the surface cells, you start to get more of a normalized appearance. With vitamin C, one of the earliest signs of vitamin C deficiency are petechial hemorrhages, because you need vitamin C to make collagen, and collagen is the basement membrane of blood vessels. So if the blood vessel is weak, then you get a bit of leaking out of the blood vessel where the hair follicle is, and you see these little red dots on the skin. You've seen this on your patients. These are petechial hemorrhages. It's a very early sign of just even a marginal vitamin C deficiency. Now, if it becomes more extensive and the hemorrhages all over the place, is ecchymosis. Often that's due to vitamin K deficiency or the interference of vitamin K by warfarin and Coumadin type drugs. Also, marginal deficiency of folic acid and B12 can create sort of a skin mottled appearance. Most people don't get enough folic acid from food alone. This is a child that would have an inability to optimally absorb zinc, and you see the effect of zinc on the skin when there's nutritional status that's been compromised. Also, cracks on the lips and also in the corners of the mouth, angular stomatitis and chelosis, even though it can be caused by cold weather and the wind and viruses, but sometimes it's simply vitamin B2 or vitamin B6 marginal deficiencies. And these little perifollicular hyperkeratosis, these little bumps on the skin, often vitamin A or essential fatty acid deficiencies or imbalances. Here you see it on the lower leg. And here's a person that was having parenteral nutrition, a feeding tube, if you will. And they forgot to put the essential fatty acids in. And then a few weeks later, you see in the bottom picture, just 2 weeks later, after giving them the essential fatty acids, how the skin clears up. So the skin needs not only vitamins and minerals, but it also needs essential fatty acids. And I'm going to show you how all this sort of factors into optimal skin development. Remember that too much vitamin A, you have some, teenager with acne, and they read that high doses of vitamin A could shrink their sebaceous glands and help decrease their acne lesions. That's true, but vitamin A is also very toxic. You store it in your liver, you get liver damage, it can produce headaches, pseudo migraines, also cause very bright gingivitis. And that's what you're seeing in this situation. So you see really bright gingiva on somebody, very likely they're taking too much vitamin A, so be aware of that. Also, the nails can be affected. This is significant iron deficiency causing spoon nails. These sort of white dots across the skin, a lot of people have these because many people have marginal deficiencies of zinc, and it can often be a sign of zinc deficiency, sometimes calcium, or it could be a fungal infection or an allergy. But very often, those little white lines that you see on fingernails is coming from a person not getting 12 to 15 milligrams of zinc a day, which normally would help to prevent that and reverse it. So back to the skin physiology for a moment, just to review a couple of things. So what you see, of course, is you have the epidermal cells, you have the dermis, and then you have the subcutaneous layer or the hypodermis. Now in the dermis, you have all these blood vessels. And see, these blood vessels come very close to where the epidermal cells are, and nutrients diffuse from those blood vessels and oxygen as well into those cells. So the cells, as they're developing at the lower levels of the epidermis, could grab nutrients and help with their maturation. So by the time they reach the skin surface, they are healthy looking cells. So once again, you see how close the small capillaries come to the lower level of the epidermis, and then these basal cells and the cells that are developing as they sort of migrate up from the lower levels to become the stratum corneum at the top are extracting really key nutrients as well as oxygen from those blood vessels that they need for their development, for antioxidant protection, for essential fatty acids to make the right prostaglandins, to make the skin smooth and soft, and to do a variety of things, total cell maturation. So here's how nutrients affect the skin. Remember that as the epidermal cells work their way up, they start producing more and more keratin, which is a very hard, corny type of protein that obliterates the cell. Eventually, the cells on the surface are dead, as you know, because they're filled with keratin. So all of the internal organelles get obliterated by the time they get to the top. But while they're developing, as they're coming up the levels of the epidermis, you see that they're extracting nutrients from the dermis below so they can complete their development. They need those nutrients. So marginal deficiencies will compromise the skin appearance and maturation and development, and also with essential fatty acids, very often even the texture of the skin. And because skin cells reproduce faster than most cells in the body, if there is marginal deficiencies happening, the skin cells are the first place you're going to see some of those deficiencies because they have a very high demand of nutrients because their turnover rate is so fast and rapid. Those cells, before they die, are extracting oxygen to generate energy through their mitochondria. Now, as they move up through the epidermal layers, the mitochondria get obliterated and the skin cells start using glycolysis as their main source of energy. But they still have oxygen. And as ultraviolet light from the sun or tanning beds or fluorescent lights enter the skin, it interacts with oxygen and other volatile components in the skin cells that can generate a lot of free radicals that can then damage all kinds of aspects of the cell, including the DNA. But it can speed up wrinkling, photoaging, and do other types of damage, weaken the skin's immune system, and also, of course, lead to different types of cancer. So skin cells are not, they're pretty smart. They know they need to make their own antioxidant defenses. So skin cells make their own antioxidant enzymes, but they need zinc and copper and manganese and selenium to activate superoxide dismutase and catalase and glutathione peroxidase. So if you're marginally deficient in any of these nutrients, you're not going to have optimal sort of skin antioxidant protection. And skin cells also derive from the blood vessels below specific antioxidants to really super fortify their defense against ultraviolet light damage. They extract vitamin E and vitamin C and beta carotene and bioflavonoids, as well as, from green tea, epigallocattic and gallate and other flavonoids that they use for protection against ultraviolet light. So what we've seen, and I'll show you the research on this, or at least some of it, that when you take an individual and you supplement them with antioxidants, the skin cells actually concentrate more of the antioxidants than they would have otherwise. And when you expose that skin to ultraviolet light, the damage to the skin cells is less. There's less oxidative damage, less DNA damage, less immune system suppression, less elastin damage, less collagen damage. So you help to protect the skin. It's not ultimate defense against being out in the sun, but it's the missing link in skincare management that no one talks about. Medical doctors, dermatologists, this is all in their journals, but they don't talk about it. But that level of supplementation becomes very important. Remember that also there's skin surface lipids. So, when people lie on your table and there's that oil slick on the headrest paper, those are the skin surface lipids that are being secreted by the lamellar bodies, which I'll show you in a moment. But under normal conditions, the skin surface lipids have very high concentrations of vitamin E and coenzyme Q10. It's the first level of ultraviolet light protection that the skin has. So if your vitamin E status is, just from food alone, you're not getting optimal vitamin E protection right at the very surface of the skin. Remember, as you get older, your CoQ10 synthesis declines. It's a good idea after age 40 or 45 for a variety of reasons to be taking a CoQ10 supplement. I like it with hawthorn and quercetin and L-taurine for heart reasons, but the CoQ10 will help to also increase the skin surface lipids. And many different B vitamins and vitamin D and vitamin A, they're required for normal skin maturation. So you want to have beautiful, healthy looking cells on the surface. You can't do it without optimal nutrients. So now we look at the National Health and Nutrition Examination surveys that have shown the percentage of the US population, we think it's true in Canada as well, who don't even meet the RDA levels for these nutrients. It's often, most people from food alone are not even coming close just to the RDA levels. And I will tell you, for many of those nutrients, those levels are too low to get optimal skin cell protection. That's what the evidence is showing. And for optimal immune system support, which becomes very important for the skin, especially as you age. So back to some of the skin structure, just wanted to show you histologically on the skin surface, you have these lamellar bodies that secrete these skin surface lipids. So in between these cells on the surface, that's where that oil slick comes from. And that oil slick is very rich in vitamin E or CoQ10, or it should be, if the person is getting the right nutrients. And again, you sort of see the lamellar bodies here secreting those skin surface lipids, which goes in between the cells in the stratum corneum on the cell surface. Now, the rest of the skin surface lipids are cholesterol and ceramides and squalene, but there are antioxidants sort of mixed into that fat-soluble sort of waxy material that are very important. So remember, in the epidermis, you also have Langerhans cells. Now, Langerhans cells they were monocytes that became macrophages. These are cells that can, a bacteria, a virus, a fungus, it gets into the skin and it can destroy it on contact. So these Langerhans cells, there's gazillions of them in the epidermis, have to be able to respond to these types of threats, so you don't have a portal of entry where something gets into your bloodstream below and creates a systemic infection or cellulitis. And there are many T helper cells as well. And those Langerhans cells, as you'll see, need certain nutrients of their own to optimize that immune system function that the skin requires. There's also melanocytes, which are in the epidermis that secrete melanin. And one melanocyte will sort of inject about 36 different epidermal cells, as you'll see, with melanin. And then there's different nerve receptors, like pressure receptors, like the Merkel receptors, that respond to touch. But there's many other types of receptors. We're not going to get into Ruffini and all these other ones, but that's beyond the scope of this discussion. These are the Langerhans cells that are staying. Look how many there are in the epidermis, and they're there for a reason. They're preventing infection. You know how older people, they easily get skin infections, and the infections linger forever? Have you seen this? It's because their immune system becomes weak as they get older. Especially as you get older, you need nutrients to support the immune system at levels that are beyond what the RDA levels are. And for vitamin C, you need 500 to 1,000 milligrams a day. You need the right blood level of vitamin D above 85 nanomoles per liter. You need 200 to 400 IUs of vitamin E. You need 2,500 IUs of vitamin A. Beta carotene, 15 to 20,000. Selenium, 100 to 200 micrograms. Zinc, at least 15 milligrams. When you do that, these cells are much more intelligent. They can fight infection much more impressively. And this is just a close look at the melanocytes. You're going to play a role, of course, in melanomas. So let's take a look at them. They have different dendritic extensions, and each of these dendritic extensions sort of feed these melanosomes, which are melanin-filled little vesicles, sort of injects that into the epidermal cells that helps to determine your skin color to a certain degree. Remember that melanin is actually made from the amino acid tyrosine. It looks like this. So tyrosine becomes L-DOPA. Remember, DOPA can also become dopamine, norepinephrine, epinephrine. But in the skin, DOPA is used to make melanin. Under normal conditions, you would make the normal kind of melanin, which is eumelanin, which is sort of black and brown melanin, makes your skin darker. Now, people who are very fair with red hair and freckles, unfortunately, they make a melanin called the pheomelanin. And that melanin actually, rather than acting as a sunscreen and protecting against ultraviolet light damage, it actually amplifies ultraviolet light damage and creates more free radicals in the skin. And that's why these people have a higher risk of skin cancer, particularly melanomas. They have to be very careful. Then in the case of people who are albinos, they're missing the enzyme that converts L-DOPA converting this L-DOPA into melanin. They're missing this tyrosine enzyme, so they can't make melanin. So their skin is completely white, almost translucent. And the iris of the eye is also, without color. And also they don't have color in their hair because you need melanocytes to do that. You need melanin to create all these different colorations that we see under normal circumstances. So here we see the melanocyte injecting its melanin into the skin cells to determine its color. But that's the color of the skin isn't just determined by how much melanin you have. If you drink a lot of carrot juice, because beta carotene and other carotenes are excess amounts are stored in the fat cells below the skin, that'll make the skin a little more orange yellow, as you know, carotenemia. And if you have anemia, because hemoglobin in the dermal layers also determines your skin color to some degree. If you're anemic and your hemoglobin drops, people look very pale for that reason. So those three factors largely determine the coloration of the skin, just to remind you of that. Now, when sunlight hits your skin, it triggers the melanocytes to then produce more melanin because the skin's already been damaged by ultraviolet light. The melanocytes respond to the damage, and then they secrete more melanin and they inject it into the epidermal cells because the brown and black melanin, that eumelanin, helps to protect against future free radical damage from ultraviolet light. But if you have a tan, damage has already occurred before the tan takes effect. It's not like I get a tan and I protect myself. The fact that you have a tan already tells you did damage. The melanocytes are responding to the damage you already did. They're helping to prevent some future damage. But there's already been some skin damage from free radicals affecting the skin from UV light. So the different vitamins and minerals play some key roles. I've tried to summarize it for you. The B vitamins are required for prostaglandin synthesis, cell maturation, for DNA repair, for cellular energy. Vitamin C for collagen formation to make certain prostaglandins, antioxidant defenses. The other antioxidants that get into the skin that fortify the body's endogenous antioxidant defense. And vitamin A and D are always required for normal cell maturation. You don't have enough A and D, the maturation of the cells won't be normal. So they're required for the development. Remember, skin cells are replacing themselves almost every month. So you have to have constant nutritional supply of these nutrients at optimal doses, or the skin cells become compromised. Even small marginal deficiencies are affecting texture and appearance. You may not even realize it. So on this one slide, and I'll send you all of this, I tried to summarize what all the different nutrients do in the skin that's meaningful. Because, when you're a chiropractor, you're putting your hands on people's skin all the time, sometimes forgetting to really look closely at the skin itself because we're so interested in palpating the tissues below. But the skin is important as well, and we should be paying attention to that to a greater degree. So in terms of the antioxidant story, we know that antioxidant supplementation has shown to increase the protection of epidermal cells to ultraviolet light. I'm going to show you some of the evidence for that, but there's much more than what I can show you in this presentation. It also has been shown to reduce skin inflammation from sun. If I take an individual and I give them antioxidant supplements for 3 weeks, and another group doesn't get the antioxidants, and I expose both the groups to the same amount of solar radiation, then the group that got the antioxidants shows much less ultraviolet light damage, less sunburn reaction, less DNA damage than the group that didn't get the oral supplementation. All other factors being the same, the group that got the antioxidant oral supplementation at doses beyond the RDA levels actually have decreased damage. It's proven. So if those free radicals damage those volatile molecules, oxygen and other molecules, creating more reactive oxygen species, the skin cells have antioxidant defenses like catalase, superoxide dismutase, glutathione peroxidase, but you need minerals to activate those antioxidant enzymes. And then you need other antioxidants that I told you about to fortify it beyond just the enzyme protection. So just to rehash how this sort of works, how this damage occurs. Remember, you have gamma rays out in outer space that normally don't reach the Earth's surface. But if you're flying in a commercial aircraft at 30,000 feet above the Earth, you're being damaged by gamma rays. You know all about X-rays, how they can be damaging, but then you have ultraviolet light, and this is the type of light coming from the sun and tanning beds, fluorescent lights that can damage the skin. Then you have the visible light spectrum, and then in the lower part of the visible light spectrum and into the infrared spectrum, you have wavelengths that actually are healing light, right? Those of you who use laser therapy and near infrared laser therapy, you're using wavelengths, photobiomodulation to reduce inflammation, stimulate collagen secretion, elastin secretion, suppressing inflammation and helping to, decrease pain as well. So a lot of you who are using laser know the benefit of this. We'll come back to it. So here's that visible light spectrum, and here's the ultraviolet light spectrum that does a lot of the damage that we're going to look at. So here again, here's visible light, and there's the infrared light. So that near infrared and infrared wavelengths have these healing properties that you probably know about if you've been treating people with laser. That's very, very significant. What's interesting to note for me is that remember that as ultraviolet light hits your skin, you also make vitamin D, right? And it's this wavelength 290 to 315, right in the UVB range, that actually stimulates vitamin D. So even though UVB can damage the skin, small doses actually help you synthesize vitamin D. So, it's like less is more. It's like a little bit is good, and too much can actually cause damage, as is the case with a lot of things in life. So in terms of ultraviolet light, there's UVA, UVB, and UVC. UVC usually gets blocked out by the ozone layer. UVB goes into the epidermal areas, and UVA goes down into the dermis, and it does a lot of damage. Now, sometimes I talk to chiropractors who think that using sunscreens on your skin like a 30 SPF is going to cause cancer and all these things. I'll leave you to your own belief system. But those types of lotions and potions and sprays do help to block the penetration of these dangerous UVA and UVB wavelengths. What I'm saying is that nutritional antioxidants can extra fortify the epidermal cells to give them another layer of protection. It's not a replacement for putting sunscreens on your skin, and it's not a replacement for staying out of the sun, wearing a hat, staying in the shade, wearing sunglasses, all the other really intelligent things that you would know to do. So no tan is really a healthy tan. Once you have a tan, basically the damage has been done. This is just a review of UVA to UVC. And remember that there's the UV index, which I'll show you on this next slide. The UV index each day that they report on the news and the weather tells you, how intense the UV waves are and how long it'll take the average skin to burn. So when you start getting into high UV index, the skin's burning in 15 to 25 minutes. So that's quite serious. So you have to factor all these things into the ultraviolet light exposure that you get. But back to what we're talking about. The ultraviolet light can cause activate molecules in the epidermal cells and even down in the dermis, generate free radicals that cause significant skin damage. And so that kind of skin damage, it not only accelerates aging, but it has its own unique properties, which we call dermatoheliosis, where it's affecting the epidermal cells. It can cause actinic keratosis, which I'll show you. It causes cross-linking of elastic fibers, upregulates some of the elastin promoter genes, so the elastin starts to pull the skin abnormally. You get solar elastosis, which I'll show you. Damages the blood vessels below the skin. You can get spider veins, damages the sebaceous glands, activates the melanocytes. So here's actinic keratosis. You've seen this maybe on yourself and a lot of people if you've lived long enough. So with photoaging, you get as ultraviolet light hits the skin and your antioxidants get used up from the exposure of ultraviolet light, you start to deplete the skin antioxidant protection. That's why it needs to be replenished every day. And you damage proteins in the skin, and you deplete the skin endogenous antioxidant enzymes, and it damages fibroblasts and epidermal cells, and it just goes on and on. But you're depleting the antioxidant supply. So studies have shown that when you give people vitamin E and beta carotene supplementation, it helps to improve the skin cell's ability to protect itself against photoaging. In fact, people that have this very serious condition called erythropoietic protoporphyria, where they have lots of iron just floating around freely in their cells, when they take massive amounts of beta carotene, it's the one thing they can do that allows them to actually go outside without taking massive doses of beta carotene orally. They can't go outside. If they put beta carotene on their skin, it's not going to do anything. It has to get into the skin cell through the blood vessels from the dermis. We forget how important that is. Also, ultraviolet exposure to human skin results in a decrease of skin levels of vitamin E, CoQ10, vitamin C, and across peroxides. It leads to solar elastosis. It gets really ugly. And solar elastosis is the thing that you'd like to try to avoid in your lifetime. It looks like this. So like once you get there, there's no turning back. And this is UV light damage causing solar elastosis. That's sort of the net effect. So, the morphology of that is affecting the elastin fibers in the skin. It's rearranging the glycosaminoglycans. It's rearranging the dermatan sulfate and the hyaluronic acid. They start taking up new positions. You're getting cross-linking of collagen. And so you're getting that net effect. You're oxidizing proteins. You get cross-linking of collagen. Starts pulling the skin abnormally. So researchers say, thus preventing or reducing free radical damage to the skin by reducing exposure to UV and increasing antioxidant defenses. Both topical application and food and supplements appear to be prudent measures in reducing damage from photoaging. So they're saying that the missing link that we haven't been telling people is to get supplements at specific dosages that have been shown to help minimize some of this damage so it doesn't occur at the same pace. Because when ultraviolet light hits the skin, it affects the fibroblast activity. It decreases collagen. It starts to cross-link. It upsets how the elastin fibers are working to support the skin. And you get a rearrangement of the glycosaminoglycans. You get total dysfunction of the skin leading to solar elastosis. That's the net effect. Many studies have shown that when you give people antioxidant supplements in preclinical studies with animals, and when they use mouse keratinocytes or mouse epidermal cells in experimental studies, all the studies show the same thing, that if you pre-treat skin cells with antioxidants orally, and then you expose it to ultraviolet light, the damage is significantly less. And that's what all of this is. Here's a double-blind study with vitamin C and vitamin E showing the same thing, also decreasing sunburn reaction. And the ultraviolet light also will damage and upregulate some of the transcription factors that lead to inflammation and programmed cell death of skin cells. It just goes on and on. And when you pre-treat them with vitamin E, you get fewer DNA fragments and fewer changes that are linked to skin cancer. And the skin surface lipids require vitamin E and CoQ10. As I told you earlier, I'm just showing you where some of this research has come from. And this is basically saying the same thing. When you expose skin to ultraviolet light, you get depletion of CoQ10 and vitamin E. And it needs to be replenished. Otherwise, the next exposure you have, your skin is very, very vulnerable. And supplementation has been shown to reverse that. And also selenium, zinc, and glutathione play an important role as well. Antioxidants, some of those enzymes that the skin's making, like glutathione peroxidase and superoxide dismutase, they require these minerals, and if they're not there at optimal levels, then again, the skin becomes more prone to reactive oxygen species damage. So that's what all this evidence shows, that when you supplement people and you do animal studies and you supplement with selenium and zinc and glutathione precursors like N-acetylcysteine, you end up decreasing skin damage quite significantly. So everyone comes to the same conclusion. All these research is dating back many years, and there's been recent studies in the last few years that have just taken this to a whole new level that I didn't really have time to put into the slideshow, but it's in the new book that I wrote. So selenium, zinc, and N-acetylcysteine also very important. The conclusion from all these research is the intensive investigation into this area of study strongly suggests that the daily supplementation of ACE, beta-carotene, selenium, zinc at levels above those typically consumed from food alone provides skin with additional and possibly essential antioxidant defenses to help slow skin aging and lends important support to other skin care preventive initiatives. So the summary is that free radicals damage the skin in many ways: inflammation, DNA damage, cross-linking of collagen, translocation of glycosaminoglycans, upregulating melanocytes, damaging the blood vessels, causing patchy, mottled skin, aging spots, and impaired immune system function in the skin. And it goes on to do all these things, depleting antioxidants, including those in the skin surface lipids. So there's this great slide that really I put this in your notes because it just shows you the importance of all those different nutrients protecting against ultraviolet light within an epidermal cell. So we'll send you these slides. You can look at them more closely. And remember that, some people say, well, I take vitamin E, so I think I just need vitamin E. Oh, I think vitamin C is the important one. it doesn't work that way. These antioxidants work synergistically. Vitamin C helps to recycle vitamin E. Glutathione helps to recycle vitamin C. Niacin helps to recycle glutathione. They work by helping to support it. It's like a whole orchestra working together. It's not one antioxidant off on its own doing its own thing. They work synergistically. Each of these are antioxidants, but each of them also help to recycle each other in this sort of pattern that I'm showing you here. So the net effect is if you put all the studies together, what you see is what becomes ideal for the skin in protecting itself against ultraviolet light and free radical damage, not only from the sun, but also fluorescent lights, tanning beds. Vitamin C at 1,000 milligrams a day, vitamin E 400 IUs, beta carotene around 15,000, vitamin A about 2,500, selenium 200, zinc 15, bioflavonoids, lycopene, lutein. They all go into the skin and play a very important role. Now, first, you want to try to minimize your exposure to ultraviolet light so you don't become overexposed. Remember that alcohol and cigarettes also damage the skin. Wear protective clothing, a wide brimmed hat, high SPF sunscreen. I would recommend it. But antioxidant supplements are the missing link in this story, and it becomes more and more obvious the more you read about it. So you see all these sort of safety tips. Many people know about this, but they don't know about antioxidant supplementation. These are the dosages that the evidence suggests is useful. And that takes me back to what I formulated a number of years ago, the Adeeva all-in-one multivitamin. It's all there in one bottle for these people. 1,000 milligrams of vitamin C, 1,000 IUs of vitamin D. They might need a little bit more through the winter months. Vitamin E at 400 IUs of vitamin E succinate, the most important anti-cancer form of vitamin E. All the B vitamins and a B50 complex. There's the iron, there's the magnesium, there's the zinc, there's the selenium at 200 micrograms, the bioflavonoids, the lutein, the lycopene. It's all in one bottle. So I think that it has many applications, that multiple vitamin for internal health. But one of the additional benefits that I rarely talk about to chiropractors is the importance of this to the skin. Now, when I'm talking to estheticians and medical spas, I make a big deal out of this. But I rarely talk to chiropractors about the skin because it sounds kind of frivolous. But the truth is, these are actually really important things to have an understanding of. So let's just quickly take a quick reminder of what melanoma looks like, right? The melanocyte itself becomes damaged and you start to end up with a melanoma. Basal cell carcinoma starts in the basal cell layer of the epidermis. And we'll come back and look at that. But remember with melanomas, the things you're looking for, right, is the A for asymmetry. B, you have an irregular border. C, different colors. D is if it's bigger than the diameter of a pencil, you need to be suspicious. And if it's evolving, if it continues to expand and grow, then you need to be suspicious because you see a lot of people's skin, so you need to be on the lookout for that. There's a classic basal cell carcinoma, very shiny red in many cases. Squamous cell also often has like an ulceration in it. And there's sort of melanoma with the different colors, irregular border, all that, those things we talked about. There's basal cell carcinoma, different sort of versions of it. So keep your eyes open for that. And squamous cell, often with an ulcerated interior. Now, basal cell and squamous cell are not quite as life-threatening, of course, as melanomas, but they are still very serious cancers that require attention. So there's the safety tips to avoid. And I would say, remember, drink green tea along the way, eat fruit and vegetables. Don't just rely on supplements to get these nutrients. And smoking and drinking, people who lie, see people lying in the sun, smoking and drinking at the same, all three. It's like the trifecta. Like, okay, good luck with that. Then there's essential fatty acids, and we're running out of time a bit, so I'm going to go quickly. But it's back to the same story that we know from essential fatty acids. Epidermal cells are going to extract essential fats from the bloodstream below, put them into their cell membrane, and from there, from the cell membrane, those essential fats are going to become prostaglandins. And prostaglandins 1 and 3 have anti-inflammatory effects. They slow down the rate of cell division. They have effects on even decreasing cancer risk. Some studies have shown that. And prostaglandins 1 and 3 make the skin soft and smooth, like baby skin, really soft, beautiful skin. Whereas prostaglandin series 2 has the opposite effect. more inflammation. It'll aggravate existing skin conditions and makes the skin a little rougher and scalier than it has the potential to be. So again, arachidonic acid, which unfortunately forms prostaglandin series 2, and then you have the omega-3 fats that make prostaglandin series 3. That's spectacular. So when you have a lot of beef and pork and high animal fat products, you're making more prostaglandin series 2, and it has a negative effect on the skin. I'll show you some of the research on that. Remember what those phospholipids look like in the skin? They're a glycerol backbone, and they've got the essential fatty acid chains. And these essential fatty acids are the fatty acids that you're eating. So when you're having fish and fish oil and borage seed oil and flaxseed oil, you're enriching the skin cell surface lipids with those fats that are going to become prostaglandin series 1 and series 3. Whereas when you're having a lot of meat and pork and high-fat dairy products, you end up with a lot of arachidonic acid, and it's more pro-inflammatory. And it has other negative effects on the body, making platelets sticky and increasing joint inflammation as well. But the studies are very clear that skin cells extract essential fatty acids from those blood vessels, and they use them to make prostaglandins that affect the inflammatory aspects of the skin and the inflammation of the skin. And I laid all the research out for you here. You can go through it on your own time. And one of the really important features, I'm going to just show you this one little chart here, is that skin cells use the 15-lipoxygenase enzyme. And when you have a lot of arachidonic acid in the skin, which is bad, it's going to make this HETE sort of icosanoid, which increases inflammation, makes psoriasis worse. It makes atopic dermatitis worse, eczema. Whereas if you have more of the fish oil EPA, you're making this HEPE prostaglandin instead of HETE, and this has the opposite effect. It suppresses inflammation. And so, all these things have a modulating effect on the skin health and appearance and can be helpful in the treatment of certain skin conditions. And here's some examples of people who were treated with fish oil who had psoriasis, and they improved. People with eczema, they improved. But I will tell you that these supplements are not the cure for psoriasis, and often they're not the cure for eczema. They are adjunctive players. They are not in themselves the full treatment in most cases. So that research goes on and on. Also, the same thing with flaxseed oil with its alpha-linolenic acid. It's been shown to actually help to improve eczema in animal studies, increases blood flow to the skin, more vasodilation, that makes prostaglandin series 3, all the things that you want. And animal studies show that prostaglandin series 2 also increases the risk of skin cancer. So this is just saying, hey, you know what? It's not just about skin softness and smoothness and skin conditions that are benign. Also, too much arachidonic acid in the skin is linked to skin cancer development. So that's what the evidence points to. So you want to get away from those high-fat meat products and high-fat dairy products. That's the first step before you start taking supplements. And then use some of the healthy oils like olive oil and peanut oil, avocado oil. I've been through this with you many times. Stay away from corn oil, sunflower seed oil, safflower seed oil, mixed vegetable oils. Remember that alcohol and refined sugars, hydrogenated fats make more prostaglandin series 2. And then supplement with essential fatty acids, which I'll show you what I'm recommending. And these vitamins and minerals also help to make more prostaglandin series 1 and series 3. When you have the right essential fats in the skin, these nutrients are cofactors that help the body make those prostaglandins more effectively. So remember that to make prostaglandin series 1, borage oil is really the key one because it's 22% gamma-linolenic acid. And to make prostaglandin series 3, it's from fish and fish oil. That's where you get the EPA and DHA. It helps to make prostaglandin series 3 as well. So, of course, nature's essential oils, I think people should take at least 2 capsules a day because it will give them that combination of fish oil, flaxseed oil, and borage seed oil. And it'll give you the optimal dosages of those things that are for cardiovascular health, but also for skin health and appearance and texture, and to suppress the accumulation of arachidonic acid in your skin, which may be linked to skin cancer. So finally, I want to tell you about hyaluronic acid. The skin cells also make hyaluronic acid. And after age 25, you start to lose it. I'll show you what it does in a minute. And it leads to crow's feet, fine lines, and shallow wrinkles. Here you see the decline in hyaluronic acid as you get older. What we know is that taking hyaluronic acid oral supplements does not replenish the skin hyaluronic acid. The only way you can get hyaluronic acid back into your skin is by putting it on topically, but it needs to be the right type of hyaluronic acid, which I'll show you. So you see the decline in hyaluronic acid and collagen as you get older. And then we see the role of hyaluronic acid in the skin. It's synthesized by these sort of fibroblast cells. It is sort of between the epidermal cells and between the cells in the dermis. It is sort of the medium in between the two. It's sort of like the mortar between the bricks, if you will. And the hyaluronic acid also has a positive effect on the skin's immune system, so it needs it for that. And hyaluronic acid stimulates receptors on the fibroblasts to produce more collagen and elastin. So as you get older, as your hyaluronic acid synthesis declines, the skin gets thinner because there's less mortar between the bricks. So you have thinning skin. And you also have less collagen and elastin, so the skin starts to wrinkle. And because hyaluronic acid holds 1,000 times its weight in water, if you put hyaluronic acid back in the skin and you're drinking normal amounts of fluids, like a sponge, it'll absorb the water from the bloodstream below and plump the skin back up, and it fills in some of the fine lines, shallow wrinkles, and crow's feet. So there's actual clinical evidence, objective evidence to show a reversal of aging in the skin if you put the right hyaluronic acid on. And hyaluronic acid in the skin is also an antioxidant that the skin requires. So as you get older, a lot of things happen in the skin, and some of it's due to a loss of hyaluronic acid. You get the elastin fibers break, you have fewer collagen fibers, and so you start to get wrinkling, and there's less hyaluronic acid in the skin to begin with. So there's hyaluronic acid in many parts of your body, not just in your skin, of course. But what we see is that by age 20, you start to lose hyaluronic acid. By age 50 years old, you're making 55% less hyaluronic acid in your skin. And you can't eat foods to get it back. You can't take supplements to get it back. The only way is by putting it on topically, but it has to be the right form of hyaluronic acid, which I'll show you. But studies have shown that when you put it on topically, it can reconstitute the skin's hyaluronic acid layers in the epidermis and the dermis, improves the skin moisture and surface sort of texture, gives a more elegant feeling to the skin. And because it plumps the skin back up, because it's going to absorb water, and it can reverse to some degree some of the fine lines and shallow wrinkles. The hyaluronic acid that you want, hyaluronic acid is a very big molecule. So if you chop it into small and medium and large chains, and you attach it to like a lipid protein carrier, you can deliver it down to the deeper layers of the skin. So you need a microencapsulated hyaluronic acid if you're going to put it on your skin. That's what gets absorbed to the deeper levels. It's been shown to reverse fine lines, crow's feet, and shallow wrinkles in objective studies where they actually measure the depth of the wrinkles with these silicone impressions. So because I lectured a lot of skincare shows over the years, someone approached us many years ago showing us their hyaluronic acid and all the research they had on it, this sort of microencapsulated hyaluronic acid. They said, we don't really have a home for it. Would Adeeva be willing in taking over this product and selling it on our behalf? And we said, yeah, this is a great product. We all use it ourselves. So a lot of spas buy this product from us. I don't feature it with chiropractors that much because it doesn't sound like a really serious type of thing. It's not cancer and, spinal stenosis and cervical headaches and, lumbar disc herniations. So to talk about, hyaluronic acid making the skin more elegant and beautiful and slowing aging, it just seems a bit off topic. But I wanted you to know that this is part of anti-aging of the skin. Anyone who knows anything about skin aging will be using a hyaluronic acid product. So we have this spray and serum set that you might want to know about. This is one of my patients from a few years ago. She was around 50 years old. After using HA for 3 months, you see diminished wrinkles. There's no trick photography here. Same with her right eye. You start to see improvement. She looks, 3 to 5 years younger. Same with Josie. She had this going on and smoothed it out. Some of this underneath the eye, and it smooths it out. So you look about 3 to 5 years younger when you use an HA product as a rule, unless you smoke and drink heavily and eat a lot of hamburgers and French fries, in which case you may not get the same benefit. So this spray serum set, very proud of it. We actually sell tons of it. So in case you're interested in knowing about it, Adeeva does have it. So the conclusion is that back to basics, really, most of your patients from skin protection and skin health and slowing skin aging benefit from the Adeeva multivitamin and essential oils, and also after age 20 using the spray and serum that I showed you. Beyond that, people with skin conditions, complexion problems, and after age 50 can also benefit from improved detoxification and immune system support, and improving digestion and correcting dysbiosis. All these things stop the leaking of endotoxins and other foreign entities from getting into the bloodstream, producing immune inflammatory reactions that can make the skin worse. But these are sort of special cases. Remember that in detoxification, a lot of nutrients are required. So if your body's not detoxifying things effectively, it builds up and it can affect your complexion. So some people with complexion problems benefit from improving immune system or detoxification function. And as we get older and our immune system becomes declines, including the Langerhans cells in the skin, we all could benefit from that. So after age 50 and in certain complexion problems, you also might want to consider giving them Adeeva Immuno Detox Prime. I think everyone over the age of 50 should take it, actually. And if they have any digestive issues, then Flora Essentials with the full spectrum digestive enzyme, high potency, with the prebiotics FOS and inulin to help foster the growth of more probiotics in the gut. The friendly gut bacteria can also help with complexion problems and eczema. The rest of the story is in my book, but it's just to sort of touch on these things so I don't forget to mention them. But back to what most of what this story is about today, and that is the basics are that a high potency multivitamin and the right essential fats with the spray and serum after age 20 can make a huge difference to skin appearance, slow down aging to a significant degree. And, that's part of the story of the skin that often gets completely forgotten about in the dermatological circles. More and more medical spas and estheticians are asking me to do presentations. I'm lecturing at many of the major aesthetic shows and the medical spa shows. So, I'm really up on this, but I don't often talk to chiropractors about it. But it's the middle of the summer. I think this is a topic that you should be aware of. I thought I would just show you how these things affect the skin. So thank you for tuning in. I'll be happy to take your questions in just a moment. But remember that if you are not an Adeeva customer, you're curious about Adeeva, just contact Arlene Walker. She'll explain to you, how we do business, all the free resources that we have, the affiliate program, and a whole bunch of other things. We have a website that supports practitioners. If you want to become a registered orthomolecular health practitioner, that's the online program for the Global Integrative Medicine Academy. I'm an ROHP. I think it's a great designation to have. So thank you very much. If you have any questions after this webinar, feel free to contact me. So while we have a few minutes, I'm going to go into the chat box and just see if there are any questions. Stephen, can you hear me now? All right. Nice to hear from you. Any questions? I don't see any. So let me just say thank you very much for sitting in today. I didn't know how many practitioners would respond to a webinar on this subject, but we actually got a lot of people who registered. So obviously it's top of mind for some people. So I'm very grateful that you would sit in, and I look forward to speaking to you again at some point in the future. Thanks again, and I'll see you soon.